What a difference a year makes. A big loss for the Democrats, with Republican Scott Brown winning the late Senator Ted Kennedy's seat in Massachusetts. With a filibuster-proof 60-seat majority gone, what happens now to health care reform and the president's agenda? Joining us now, House Majority Whip James Clyburn and Minority Whip Eric Cantor. Gentlemen, a pleasure to have you with us. Thank you for joining us. Representative Clyburn, I'd like to start with you. Is health care reform dead, or will Democratic leaders basically ask the House or push through the House the Senate's version?
It's not dead by any means. I have always maintained from day one, if you look back at some of your file clips, you will see it. I have always said that the magic number on health care reform is 50, not 60. And I do believe that we will have a health care reform bill, and we will have one that the American people can be proud of. I've always maintained that you build a good foundation for legislation, and you work on it over time. We did that with Medicare. Medicare, as we know it today, wasn't done in the first bill. We did it over time.
Representative Cantor?
Well, listen, clearly the whip here suggests that the majority is intent on jamming through this health care bill. And what I think is amazing to me, as well as the people, most of the people of this country, after we've seen the outcomes of the elections in Virginia, New Jersey, and now even Massachusetts, how it is that they could continue down this track. The message I got from last night is that the people of Massachusetts are really tired of the arrogance. If you look at the shenanigans that surrounded the Senate bill and all the backroom dealing and the trading of billions of dollars, people are tired of being told that that's how it's going to be, and we don't care what you think.
All right.
So Republicans stand ready to say, look, we've got a health care reform bill. I met with Jim's colleague, the Majority Leader, Steny Hoyer, several months ago, and I said, we've got a plan. We've got a plan that I believe will affect positive reform without driving up the cost and driving us into a government situation the way that their bill will.
Okay.
Congressman Clyburn, there has been a lot of dissent now that we're hearing from Democrats. Do you think you'll be able to push this through without acknowledging any of these demands for changes within the bill?
Well, let me tell you what Massachusetts said to me. It said to me that those of us in this state of Massachusetts, 98% of us are now covered by a health care plan that we like. And we don't particularly want to help pay for the other 49 states to have a similar kind of coverage. Our responsibility here in the Congress is to try to do for those other 49 states what's been done there in Massachusetts. And that's what it says to me. I would love to find out whether or not my good friend Mr. Cantor wants us to continue to have pre-existing conditions denied. A little child born with juvenile diabetes can't get on his parents' plan. This is the kind of stuff you're trying to do.
Congressman Cantor, you know, actually that Massachusetts voted against the Obama health care plan is striking because Massachusetts has universal coverage, but the budget is already 38% over budget 3 years after it got adopted. It's at $1 billion instead of $725 million. So do you think the rest of the nation really wants a Massachusetts-style plan that's 39% over budget?
No, I don't. And, you know, I think that the kinds of things that Jim suggests that we want to do, which is to affect positive reform as far as insurance companies are concerned, all of us are for accepting an attempt to try and do that. It's just how you do it. I think you make the point is Massachusetts has already blown the budget on their bill, and the people in this country, in that state, have rejected this budget-busting spending. But it's not just been that. It's been the stimulus bill. It's the cap-and-trade bill. It's the budget. It's to take over the auto companies. It's the card check bill. People in Massachusetts, like Virginia and New Jersey, have now said enough is enough. Please, Washington, start listening to us.
Congressman Clyburn, you know, Mr. Cantor says that he has that his side has a bill. They want to talk. Do they, or is he being insincere here? And if he's not being insincere, I think a lot of Americans would wonder, why the heck can't you guys get together and collaboratively solve the problem?
Well, you know, bipartisanship, you know, bi means two. It means more than one. We have reached out. This president has been as bipartisan as you can possibly be, almost to a fault. He's now, next week, will be addressing the Republican conference. That is the kind of outreach that you would like to see the president make. The fact of the matter is, though, we should return that outreach with some suggestions as to how you would do something. We've had over 200 amendments on this bill. Many of those amendments have been Republican amendments. When you look at what we've done in trying to put together an exchange, trying to put together this high-risk pool, that came right out of McCain's proposals when he was running for president of the United States. So to say that we have not incorporated Republican ideas is just a bunch of poppycock, and they know it. But it sells well. Does it go out to the American people?
Let's let Mr. Cantor have a final word there. Poppycock, says Congressman Clyburn.
First of all, listen, we have from the very beginning said, here's our plan, come work with us. They have, to a person, rejected our participation. It's gone so far as, the majority leader telling me there's no use in talking to Republicans because they reject the public option. We can, if the Democrats who are in control here, we can work together. We invited the president to come to our retreat next week because we want to tell him, look, we've got differences with you, Mr. President, but certainly we ought to be able to start over on this health care debate and affect positive reform. Certainly we ought to prioritize the things that we do here in Washington, which is number one, let's address the economy. Let's get people back to work. That's what the people expect. That's what resulted in this election last night in Massachusetts. Washington's not listening.
All right, gentlemen, thank you very much. It's been a pleasure to have you both with us.
Well, thank you so much for having us.
Great get by our producers. Really good to have the two whips there.
And we only talked about health care. There are a heck of a lot of other issues that
So we will have them back,
that are
gentlemen.
logjam.
Please join us again.
And still